Torsades de Pointes is a French term that describes a very important cardiac arrhythmia. The English translation is twisting of the points. This is a rhythm that is characterized by shifting sinusoidal waveforms on EKG. When you trace the points from the top of the QRS interval, these are all QRS complexes that are just repeating and repeating. If you trace the tops of these QRS waveforms, we see a sinusoidal wave, and we see this sort of twisting of the points. The more official term for this rhythm is polymorphic ventricular tachycardia. And we can see that these QRS complexes all have different shapes, so they're called polymorphic. And then we can see that the heart is beating very fast. It's tachycardia. Remember, these are all QRS complexes, or ventricular depolarization events. Polymorphic ventricular tachycardia. We're not going to go into all the details describing the exact pathophysiology of this arrhythmia, but we're going to go over some important concepts. Number one, it's important to know that this cardiac arrhythmia is very dangerous. It's a life-threatening cardiac arrhythmia that if we don't intervene quickly can actually take the lives of our patients. The etiology or underlying pathophysiology is caused by a prolonged QT interval. So a prolonged QT interval, which is appreciated on our EKG, makes us concerned for the potential of developing Torsades de Pointes. So remember, the QT interval represents ventricular depolarization and repolarization. So when it's prolonged, we're at risk for developing this ventricular tachycardia and this polymorphic ventricular tachycardia. And so just remember that a prolonged QT interval puts patients at risk for developing this rhythm. And can you tell me some things that prolongs the QT interval? What are some patient factors or some things that we do that would put a patient at risk for developing this rhythm? Well, classically, the important things that will put your patient at risk for this rhythm are drugs. The important drugs to remember are antiarrhythmic drugs, particularly class 1A, class 3 antiarrhythmics. Certain antibiotics can cause the QT interval to be prolonged, including, most importantly, the macrolides, such as azithromycin, clarithromycin, erythromycin. And then finally, the antipsychotic drugs, such as haloperidol or the tricyclic antidepressants, prolong the QT interval. So we have haloperidol, Haldol, TCA drugs like amitriptyline, as well as antiemetic medications such as Zofran or ondansetron. These are the key medications that would put a patient at risk by prolonging the QT interval. And then finally, the electrolyte abnormalities, such as low magnesium, so low mag, and low potassium, are classic electrolyte abnormalities that put patients at risk for this condition. And how is it treated? Well, the treatment is pretty simple. It's magnesium sulfate. So the treatment for Torsades is magnesium sulfate, as well as transferring the patient to the ICU or possibly protecting their airway with intubation if they're really decompensating in front of you. But the drug that you would give is magnesium in the form generally of magnesium sulfate. It also turns out that people can be born with specific gene mutations that predispose these patients to this arrhythmia. In general, these patients are born with gene mutations of the potassium channel, which place them at risk for a prolonged QT interval. So there are the mutations in the potassium channel that actually causes them to have prolonged QT intervals. The two important congenital syndromes that you need to be aware about are the Romano-Ward and the Jervell and Lang-Nielsen syndromes. They have different modes of inheritance. Romano-Ward is autosomal dominant, while JLN is autosomal recessive. And they also have some different phenotypes or different associated conditions. For instance, Romano-Ward really only affects the heart. It only affects the potassium channels of the heart, while in JLN we see a characteristic deafness. This is critical to differentiating the two. Patients with JLN syndrome have deafness in addition to prolonged QT syndrome. So in review, Torsades de Pointes is a dangerous cardiac arrhythmia that is caused as a result of prolonged QT interval that is ultimately a result of certain medication administration or electrolyte abnormalities such as low potassium or low magnesium, or it is seen in patients that have these congenital syndromes, Romano-Ward or Jervell and Lang-Nielsen. The key difference between these two is that one causes deafness and is inherited differently, versus the other only affects the heart.